Well, we'll be talking about the complications of rheumatic heart disease. I'll be talking about the various types of treatments for them, including medical treatments and also surgical treatments. So this one, the first presentation that happened to open was what? A treatment. So that's how I'll be discussing based on what is coming. So this is what is known as a valve replacement surgery. Okay. So literally, the name actually explains the whole thing. Valve replacement just means there's a bad valve, so you're actually bringing a good valve. A man-made valve, yeah, it could be made from animal too. It could be made from materials, So you just want to replace the valve that is bad. So valve replacement surgery, we say that it's a major cardiac procedure, and it's performed when the heart valve is too damaged to be managed. Like, you can't keep up with it, so they just have to remove and place a new one. So it restores normal blood flow by replacing the diseased valve with an artificial one. So the surgical replacement of a diseased heart valve, most commonly the valves that are affected are the aortic valve or the mitral valve. So you replace them with an artificial one. Now that artificial valve, they call it a prosthetic valve. So purpose is just to correct any issues that bad valve is bringing, like all those stenosis, regurgitation. So there could be narrowing or there could be leakage, depends. So of course the person is suffering from all this heart failure, the person is suffering from abnormal heartbeats, the person is suffering from other complications. Okay. So types of valve replacement, we have the mechanical valve replacement, where you use durable materials like metals and carbons. It can last for over 20 years plus, but the person has to be taking anticoagulants for a lifetime. We have the bioprosthetic one. That one is made from animal tissues or human donor, you understand? So it's much more compatible. Have the transcatheter valve. This one is delivered via catheter, good for high risk surgical patients. Okay, that one is just by the way. So indications, when will you actually want to replace a valve in a patient? When there's severe aortic stenosis or severe aortic regurgitation. Okay. When there's mitral valve stenosis or mitral regurgitation. Okay. When there's valve disease causing all those heart failure, syncope, and angina. When there's valve damage from rheumatic heart disease, endocarditis, or congenital defects. So the procedure is just simple. You put the person under general anesthesia, and you use a heart-lung bypass machine setup. So the diseased valve will be cut out, and the new valve will be sewn into place. Okay. So that's what is it. Okay. So here is not to describe detail on how it is done. It's just for you to know what it is, okay, as a student, and make progress with your life.